Hey everyone, I'm Sherry Cole, Chair of Norman Regional Health Foundation's Equip for Tomorrow campaign, an opportunity for you to invest in the future of healthcare and education excellence in your community. The $4 million Equip for Tomorrow campaign takes Norman Regional Health System to the next level. It focuses on 5 healthcare areas: cancer, cardiovascular, perinatal, and physical rehabilitation, as well as the renovation of the Education Center. The goal is to enhance education and bring the best medical devices and treatments here to Norman Regional so patients can heal close to home. One cancer survivor told us that it made all the difference.
When I woke up from that colonoscopy, they told me that I had colorectal cancer. I just turned 34, how can this be? Having care at Norman Regional allowed me to not have to travel or go out of state to another facility. It allowed me to have the opportunity to have care and my family within a very close distance, as well as working and being able to have that normalcy of life that I so desired because I didn't want to feel like I was a cancer patient.
Funds from this campaign will be used to purchase an endoscopic ultrasound. Gastroenterologists use it to evaluate cancer of the colon, such as what Michelle had, along with cancers of the esophagus, lung, pancreas, and stomach. Your gift will also be used to make lumpectomies easier for breast cancer patients through the use of cutting-edge technology.
A caveat is that the surgical margins must be clear, and that means that when the pathologist is sampling that specimen and evaluating it under the microscope, there can be no cancer cells at the edge of that piece of tissue that we took. That's not an answer we can have while we're in surgery. The Clarix imaging device takes an actual CAT scan of the specimen and will show us the mass or calcifications, imaging abnormality that tumor produced, so we can see how close to the margins those abnormalities are on that image. New technology allows the surgeon to walk that fine line between taking enough tissue to make sure we get those clear margins, but not over-excising and leaving a larger cosmetic defect than we need.
When it comes to treating heart attacks, every second counts. That's why a major component of the Equip for Tomorrow campaign is the addition of a procedure room that's fully stocked and reserved for only the most serious cardiac cases.
Heart attack patients require very quick treatment. The longer a patient goes with a clogged artery, the more damage to their heart and the worse they do.
We go to the hospital and we go to Norman 9, and it just recently opened up. And we get there, they carry me to the back and pretty much say, hey, we think you're experiencing a heart attack. And I'm kind of shocked there for a minute because that's, those are words that you really don't want to hear. The paramedics get there, and it's at that point where, hey, we say, okay, I have a cardiologist at the Heart Hospital South Side. Can you transport me there? And no, you're too critical at that point. So we need to take you over here to the Healthplex. In dealing with a heart attack, minutes count, seconds count. So that facility being there was a true blessing, because if not, I might have driven to the Heart Hospital. So get to the cath lab, and I'm still pretty coherent at this point. And as we get there, Dr. Sellers, kind of explains to me, hey, here's what's going on, having heart attack. For what was going on, for what was happening, I cannot say that I had a bad experience at any point during that time.
When a couple is ready to become parents, they plan the showers, the nursery, the sleep schedule, and everything in between. But they never plan for a trip to the NICU, the Neonatal Intensive Care Unit.
The babies we see in the NICU are very fragile, some of them barely weighing a pound. It's important that we not, touch or overstimulate those premature babies, because when you do, sometimes that can set them back. They can get stressed. That's why we requested these new warmers. All of the features that we need are kind of in one warmer. These warmers would allow the moms to come in and do skin to skin while the baby still receives the heat from the warmer.
The boys were born 28 weeks early. We went in because my water had broke. So we were in Hotel Norman Regional, as they call it, for 5 days before they were born at 28 weeks. Part of the testing in the NICU is heart ultrasounds, and brain scan ultrasounds, along with like multiple blood tests on like how they're oxygenating and everything. So the scariest one for us that we weren't ready for was the brain scan, because we didn't realize like how serious a brain bleed could be or how common a brain bleed was in a premature baby. So they did brain scans every week for the first 3 weeks, I think, to make sure they were okay. It's really comforting to know that they don't have to move them for the testing because, you know, especially when they're premature like that, they tell you the more jostling it is, it's painful to them to move them around too much. And so to not watch them scream or cry and to just sleep through it, it's incredible. And the fact that, you know, one thing you worry about with preemie is their oxygen. They're on oxygen all the time. To move away from the NICU out of that bubble of basically sterility is super scary because you don't know what they could catch if they get out of their incubator. So AJ came home first at 3 months basically of age. He came home on what would have been his actual birthday on February 15th. He came home off oxygen, which was a huge win. And we got to spend 2 weeks with him alone at home and getting used to a baby. And then Joe followed on February 27th, about 2 weeks later. And for each of them, we did what they call a rooming in, where you stay with them at Norman Regional for the night and get used to having them and make sure you can feed them and change them and take care of them before they go home.
Today, a local young man is quite literally a walking miracle thanks to a revolutionary device that helped him learn how to walk again.
Caleb was on his way to an OU basketball game. It started raining in Oklahoma that night, so the roads got slick real quick. He was coming off the exit and he hydroplaned right into the middle of Interstate 35. And a 75,000-pound semi-truck T-boned him directly on his side.
That was one of my favorite machines I've used because it gives you such a freedom. Like, you have something holding you up, but at the same time, you don't necessarily feel like you're codependent on something else. Like, you just feel like you're walking and you're running.
The patients that are going to benefit from this the most are those with neurological deficits. Patients who've had a stroke, a brain injury, a spinal cord injury. But beyond that, there's also a lot of other considerations that you can use this equipment for. A patient who's come to us after amputation, a patient who is medically complex and hasn't been out of bed in a long time and they're deconditioned, or an elderly patient who has a high risk of fall.
Inspire Health will modernize the way Norman Regional cares for our community. In conjunction with that, Equip for Tomorrow will modernize the way Norman Regional healers learn about the latest advances in healthcare.
In many ways, the Education Center is the lifeblood of Norman Regional. I honestly don't know what we would do without it. We educate thousands of healers every year with classes for CPR, advanced stroke life support, wound care, continuous renal replacement therapy, MANT, and other certifications. Soon, it will host classes for the OU College of Nursing. The Education Center is home to many community events such as Rotary and chamber meetings, stroke and cancer support groups, breastfeeding classes, Lifeline screening, and one of my personal favorites, Kids Are Special People. We want to give our healers and the community the best learning environment possible. And to do that, we must upgrade our technology.
I want to invite you to join us in enhancing healthcare in our community. Thank you for investing in the Equip for Tomorrow campaign. Your gift helps people in the community of Norman as well as the surrounding areas, and it will go on and on and on.